space where beauty meets authenticity and transformation is not just a possibility, but a promise. I'm absolutely thrilled to introduce you to someone truly special, Dr. Rukmini Vinaya Rednam, the compassionate force behind the countless remarkable transformations in the vibrant city of Houston, Texas. Picture this: every curve, every contour crafted with care and expertise, not just by a board-certified plastic surgeon, but your very own cheerleader for self-discovery and confidence. Get ready to embark on a journey where we explore the art of science of feeling your very best self. This isn't just a podcast. It's your cozy corner of empowerment and inspiration. So pull up a chair, pour yourself a cup of kindness, and let's dive into the Confidence Doc podcast with Dr. Rukmini Vinaya Rednam.
Welcome back to the Confidence Doc podcast. I'm Dr. Rednam. I'm a board-certified plastic surgeon in Houston, and I am here with a very special guest today. I have Dr. Betsy Grunch. She is a board-certified neurosurgeon and content creator. Many of you will know her by her name known as Lady Spine Doc. Welcome to the show.
Thank you for having me.
So you are someone that I've enjoyed following for some time right now, but a lot of our listeners may never have heard of you, so I want to make sure that they get to hear all the details about what makes you you. So why don't you tell our listeners just a little bit about how you became a neurosurgeon?
So I'm in Atlanta. I've been a neurosurgeon for about 11 years in practice. I came into neurosurgery kind of through an event that happened in my life when I was young. I think all of us being in healthcare kind of have a reason why we went into certain fields or why we were drawn to certain fields. For me, my mom was a police officer when I was little growing up. I always wanted to be like her. I just thought she was so cool. I loved what she did. She loved her job so much. And the week before I started high school, she was involved in an auto accident in the line of duty, was injured in the line of duty, and suffered a C4 spinal cord injury, which was devastating to our family, obviously, to her, and the whole process for us through as a family was just, it was a lot. We were in healthcare. We were kind of thrown into I grew up, no one in my family's in healthcare. So we're catapulted into this whole whirlwind situation where we didn't know anything. And so I was around all kinds of healthcare professionals, physical therapists, occupational therapists, surgeons, nurses. And I just, I wanted to learn more about neuroscience in the spine because I just found it to be incredibly I didn't want to accept that she could never walk again, and I wanted to try to learn more about how I could do it, how I could fix it. And I became very interested in the spine at that time, and that was just kind of the beginning for me. And spending time through shadowing people in her surgeon, and then going through college, medical school, etc. Nothing else really excited me like neuroscience. So that's kind of the short and dirty version. But yeah, it's just been, I just love this field. It's such a rewarding field. I love taking care of people with issues with their brain and spine, and yeah, so that's why I do what I do.
Was your mom really excited when you said that that's what you wanted to pursue?
I mean, she has always told me ever since I was little that I should do whatever I wanted to do with my life, and that, she's always been supportive. So it wasn't she wasn't excited per se, but she was just you can do whatever you want. I think at the time that I decided that, she was in the middle of her own, just kind of rehab and stuff. And it's been tough, but no, she's my biggest fan. So she's there. She's such just a great person in my life that's really given me the confidence to think that I could do something like neurosurgery, and particularly at the time where you trained and I trained, it was still persistent, male dominated field. So it was helpful to have that person that always had my back no matter what. So
It's always amazing when that person's your mother too, right?
Yeah,
Like it's just
it's
like,
helpful.
rooting for you in your corner. So I love that.
Yeah.
Well, I don't think a lot of people realize how much work it takes to become a neurosurgeon. Can you share a little bit about what the training process looks like?
So as to be a neurosurgeon, you have to go through college, get accepted into medical school, do 4 years medical school, and then be accepted into neurosurgery residency. So neurosurgery residency, at the time when I trained, it was a 1 year general surgery internship, and then the residency program was 6 years, and it was kind of integrated, so 6 years total. Now I trained before the work hour regulations were more strictly enforced, and so that training time has been extended. Now if you want to do neurosurgery, it's probably 7 to 8 years. So that's after medical school. So total after high school, about 16 to 18 years, depending on if you do a fellowship or not. So it's a long time. I'm sure it's similar to plastic surgery.
It is. I still think neurosurgery has a speed. If you do the integrated route, it's 6 years after medical school. And then I did a fellowship, so then it made it 7 years. But if you do the traditional route, it can be anywhere from 8 to 9 years. So yeah, it's not for the weak. It's not for the weak-hearted. But you also, more important than being weak or not, I think it's about loving what you do. Because when you really love it, then, yeah, it's a lot of work, but it's worth every hour you're spending.
Exactly. Yeah. I think that's the key point, is just doing what you love, because you have to have some kind of driving force to do this, career. Like there's so much time invested in heart and soul and money and to pursue something that you just don't have a passion for. It's just not worth it.
It would make the days longer than they already are sometimes.
Oh yeah.
So one thing that I think is really unique about you that I think you've done very well is kind of balancing being a content creator with having an extremely busy practice.
Am I balanced?
Hey, I'm giving you you give the appearance of it. That's actually the same answer I said to somebody else. They're like, how do you do it all? I'm like, I do.
You what?
Excellent. I'm giving the right opinion. So how do you do your best, let's say, balancing, rather than saying perfectly balanced, doing a lot of content creation at the same time as being a busy neurosurgeon?
Yeah. It's it's just one of those things that I think once you get the hang of it, it's just kind of your routine and what you do. For me, content creation is just something that is like an outlet. I really just love doing it. And I think it's fun. I mean, it's just similar to our passions of doing medicine. Like, really, to be a successful content creator, you have to have a passion for it, because it's really easily portrayed through the audience. If you have someone that does your content for you, it doesn't come across the same as your own. And so I just I wasn't sure what I was doing when I first started, and definitely wasn't like, oh, I'm going to be, this huge medical content creator. It was more like, I'm bored, let me just post a video, and then kind of unfolded from there. And for me, I just kind of post a little bit about my life. I don't really try to focus too much on medicine, because I think that gets a little boring. I mean, I know a lot of people love the medical content, obviously, but like for me to sustain doing it, it's just a little bit about me and where my mood is of the day, or what I'm feeling. And obviously my niche and like roots are being a medical doctor and portraying, relaying information in a very clear and, non-misinformation way. And also, just trying to show what we do as doctors. We're human. We have fun. We have kids. We have a life. And I think it's really important for the next profession. I mean, social media is becoming something that's commonplace. And when you probably for you too, but when I was growing up in college and in residency medical school, it was around, but you really weren't supposed to use it. You didn't, you weren't.
It was just pictures. It wasn't really
So, it's definitely grown. And I think this generation of adults that are coming out, it's just part of how they look at things, how they look at the world, how they get their information. And if there's not people out there that's spreading good information, then it can be a bad thing. So I find enjoyment, and I also just think it's a unique way of reaching people and giving them a little bit of insight into what it may be like if they want to pursue this profession. So yeah.
So, how do you respond to, and because everybody gets trolls, right? Everyone gets these comments. So, how do you respond to people who are like, well, that's not professional. Why? I don't want my doctor dancing. I don't want my doctor apparently having fun at all. Like, how do you respond to that? Because I know everybody kind of responds a little differently with
Yeah,
this.
I mean, like the 20 comments that I just read on my earlier. Yeah, you know, I got a lot of I get a lot of that. All of us do that are on social media. It's unprofessional. What are you doing? Why are you doing this? And um, at first, I was like, I don't know why I'm doing this. mean, so I actually got called into medical staff services at my hospital initially when I first started creating content, and was kind of asked to stop, so to speak. But I
Really?
think it's so important to relay information. It's not unprofessional. It is literally reality in this day and time. I mean, there are some unprofessional ways of going about doing it, but let's be real. Like we're not professionals 100% of the time. We're human beings, and I mean, I'm not doing anything that is by any shape of the means not appropriate for putting out there. So, I to answer your question about the trolls, it's hard. I mean, I really think being a content creator may be harder than being a resident. You get so much heat and like
People
judgment.
can be really personal too with how they. Yeah.
And I mean, like it's just like they hide behind this cloud of anonymity or whatever the word is, and they they can say whatever they want, and I still get hurt by a lot of the things that people say, less so than I used to, but I think you just have to develop this shield around you and realize that people are saying those things because they feel something about themselves that they have to. So
Hmm.
if I feel the need to respond, I try to just turn it back on them and like, wow, maybe you should learn to be a little nicer. People
Hmm.
make these comments, and I just don't know how a lot of these younger folks handle it. I think it's tough. It's definitely not for the weak, and it's something that really, even the strongest of us do take some of the things people say to heart, and it's hurtful. It's hurtful anytime somebody doesn't like you, but that's reality. I mean, not everyone's going to like you. I tell my kids that you can't make everybody happy, and you just kind of have to um, learn where you belong and fit in, and learn where you don't. And I think it's definitely been a learning point for me it helps me be a better person to read and integrate what people say about me, so I can reflect on that and see if there's anything that I need to change about
Hmm.
what I do, or whatever the case may be. So it's definitely it's something.
It's hard. There's times where I just choose to block somebody because I'm like, I'm not going to teach this person. But every once in a while, there's someone that I'm like, okay, let me really try to respond, not in anger, and just like respond to teach them. And sometimes I get surprised that somebody's actually like, great, I didn't really realize that. You're right. Sorry. Now that's not common, but every once in a while, it's nice, And
Yeah.
you share a lot of your family. You have 2 children. And it's that also is sometimes controversial, right? I put my kids out there too, and I just want people to see that I'm a normal person. From looking at your socials, you look like you have a super fun team that you work with. And I
Yeah.
think that as a patient, I want to see that. I want to know that, like, not just my doctor, but everybody's taking care of me really seems to enjoy working with each other and caring about each other.
Yeah, I think your team, so to speak, is like your home team, your work team, and for me, I choose to share that. Not everybody wants to do that. It's just a part of who I am. I'm a very open book, and I really talk about my life at work, my life at home, and I choose to show that because I think I do think it's something that is important for people to understand, that we are, humans in terms of what we show about our work team. For me, it's a way of stress relief for all of us. We really enjoy doing it. And, people always ask, well, do you have like dance auditions or something for new staff? No, of course, I don't force my team to do it. If they want to do something, they do. If they don't, they don't. But all of them really, for the most part, really enjoy it. And yeah, I mean, we are really as close as we are, probably even closer than what we portray on socials. They're some of my greatest friends, I just love them and trust them for everything that I do at work, because you really are only as strong as your weakest link. And so I think whatever brings you closer together and portraying that it's helpful, because it's helpful to know that there are doctors out there that actually, respect their staff, or that actually treat people nicely, because you should be. That's how teams should work. You shouldn't really unnecessarily be exposed to toxic environments, and you're going to get the best patient outcomes by having a team that feels open enough to communicate with you. So I think most patients get it, like, hey, I'm going to see Dr. Grunch and her team, and they communicate with each other. They're open. There's some people that don't like it. And that's fine. They can find another team, but I can tell you there's not going to be another team that doesn't care more for them than us. So
I'm 100% the same wavelength with that. Like, sometimes people think it's strange, but I'm like, I love my team. I literally love them.
Yeah.
I know they've got my back and I've got theirs, and like we even all start sounding the same because we all are in the same wavelength. And so I think that's a really important thing, and I think that's something that does make for better care long term. So let's say, supposing somebody's listening and you've talked to somebody who's very interested in doing what you do, right? How do you, and I don't ever think that this is perfectly balanced, but how do you manage being a mom and being a surgeon?
It's definitely you have to have a good team. I couldn't do all the things that I do without, the people that I work with helping me take good care of patients, allowing me to trust their care in this. And then my husband at home, and my in-laws, my parents, my family, my babysitters that help us, like all of those people really allow us. Sometimes it seems like complete chaos, but it's really like organized madness, really. And to be a mom, you have to be a good leader. To be a good surgeon, you have to be a good leader. So it's all these like kind of navigation skills of, okay, who's going to get the kids today? Where do they have to go? Where am I going? What podcast am I doing today? Like, how am I going to do X, Y, and Z to make sure that all this stuff comes to fruition seamlessly? And it's tough. And, to get your question earlier about balance, it's not like really like, oh, I'm good at this day and good at this day, and every day is like perfection. It's really about, sorry. See,
Fur babies.
That's my Instacart order that just came in because I'm home. My dogs are alerting me. It's real. Sorry.
You're fine.
It's about, it's about like days that are you'll have your cup being filled with, as a good surgeon, and then maybe you're not the best mom that day, and vice versa. And, it's how it comes across the board. You want to have like kind of days where you feel like each cup is being satisfied and fulfilled in that way. And it's not something that you just wake up one day and you're good at something. I mean, you really train yourself to be a good surgeon, and just like that, to be a good parent. And I don't know, it's been something that I'm still working on, but I think I've gotten better. Kids have gotten older. They've survived.
They look happy and healthy. That's all you can wish for.
That's right. That's right.
And I think there's always a struggle. Like, my mom stayed at home with us until we got much older, and then went to work. And I know that in time she's always like, go out there, do everything you want to do. And other times she's like, spend more time with your children. And it is hard. There's days I win at one, like you said. There's days I feel like I win at the other. But at the end of the day, I feel like I'm setting a good example that my girls can do whatever they want to do.
Right.
And having a supportive partner is everything. It really is. And I know you share a lot about how wonderful your husband is. Yeah, which I'm sure he appreciates.
He's great most days.
Nobody wins 100%.
No, exactly. Exactly. And your relationship with your spouse or your significant another, or whoever you choose to spend your life with, is also equally as important in these relationships that we fulfill in our life. And you kind of have to work at them just as hard as you work at everything else. And communication is important. It's important in medicine, it's important at home. And
Hmm.
as long as there's open lines of communication, and you feel heard on both ends, and you respect each other, I think that's the key to success. So
I totally agree. I totally agree. So, how do you feel that since, like, you started really your social media around 2021, like, kind of getting into it, it's really grown since then, both on TikTok, Instagram, other social platforms as well. How do you feel like it's impacted your professional and your personal life?
I mean, it's really, I don't want to sound like corny, but it's really changed me as a person. It's probably one of the best things I've ever done, because I do think it helps me become a better person, to understand like how I can speak more clear to get my point across, and to share my life, and to not be afraid of who I am. And just to be me, and to be respected, by some, and maybe
Hmm.
not so much by others. And it's just taught me a lot of lessons, and it's given me so many opportunities too, which is I'm so grateful for. It's been a crazy journey. And you know, sometimes we succeed in things and sometimes we don't, and it's just been a blessing. And I'm just happy to have people that support me and like what I do. And um I don't know. That's about it.
Oh, and I can tell you, I am positive you inspired people, not even just people who want to be a neurosurgeon, right? Like, I'm sure you've inspired people in many ways because you absolutely come across as extremely authentic yourself and you just seem super fun. So, I mean, it's nice. It's nice to be able to just be yourself, right? And celebrate that.
Yeah.
And I would totally have to bring this up because, especially being a plastic surgeon, is that you're somebody who had gone through weight loss journey and is like super fit now, looking amazing. Would you mind sharing a little bit about like what that path was like for you?
Yeah. So as medical training, as toxic as it is, it's, been something that has really just kind of also affected people negatively. For me, it really was hard. For me, I took a lot of my stress out eating and becoming unhealthy because of our work hours. And I was really overweight. And when I started into practice, I've always been overweight, but just the more I studied, the more I indulged my stress habits. And um, you know, I think as doctors, we know when we're not healthy, and we think we know how to change it. I struggle for a really long time and how to like do that. And I was always very athletic. I always played sports, but it was like the nutrition part that I didn't really understand. So I started really learning about like teaching myself that, because they don't teach it in medical school. I think that's something that a lot of people don't realize, is that I don't think we're trained very well in terms of
Mm-mm.
nutrition. And so, I just a slow grind, man. I mean, it's something that I started as soon as my daughter was born in 2018, is really when I really, really started becoming more cognizant of my nutrition and health goals. And it's slow over time. So I lost about 85 pounds after I'm sorry, lost about 50 pounds after I had her. And then, as I've disclosed on my socials, I had a plastic surgery because I had so much skin. My babies were both 10 pounds. I had diastasis. I had, extra skin from losing weight plus baby weight. And my plastic surgeon, I'll say, I mean, she gave me the confidence of what I had now, because I'm a different person before and after surgery. I just never, I'm just so thankful for plastic surgeons. You guys really do amazing work. And it's true. Like, you're not looked at the same as a woman of a certain way than you are as like where I am now. People think and look and treat me much differently. And
Mm-hmm.
it's disheartening, but it's reality. And that mommy makeover, the abdominoplasty, the fixing of the diastasis, and my breast lift and all that stuff really just kind of made me feel pretty. And it gave me the confidence that I don't think I really had for many, many years. And then that confidence allowed me to continue to change my habits and become where I am today. So y'all are doing God's work.
Saving the world one boob at a time.
That's right. Hey, it's true.
Well, but I mean, it really is that though, right? Like you can be a mentally very confident person, but sometimes body confidence just feeds into that too. So, and I'm sure when you did that, that was 100% because you wanted to feel the best you could feel. It wasn't because people are telling you have to. And like, that's the way to do it, right? Is because it's for you and nobody else. It's just nice. Other people can enjoy it along the way.
Right. No, I mean, no, not many people have seen my scars, but it's something that you look at yourself every day in the mirror, and when you feel good about yourself, it just gives you so much more self-esteem, and it's just it's so great. I mean, it's really life-changing. I think many women I've spoken to, and I talk to women about all the time being in spine. I mean, patients with large breasts, it can affect their spine, and even abdominal, like you don't think about it, but like even women that have had big babies like me and have big diastasis, that affects your core strength, and that affects your back pain. And, all these things are so important in how you feel every day. And so I do think it's something that's under-recognized in terms of how it helps even your overall physical health too.
Correct. It's not literally, even though we get pegged as the skin deep specialty, we do things that impact a lot deeper than that.
Yeah, for sure.
So one thing that you've done recently that is pretty cool, I think, especially being in this field, is that you've started your own clothing line.
Yeah.
So how did that even come about?
So it kind of started as like, I wanted to, I love the brain. I love the spine. I love clothes. I like, wearing colorful scrubs and shoes and that kind of stuff. And so I just I wanted to design a cool shirt with a brain on it. I wanted to design a cool shirt with a spine on it and medicine. And it's hard to find stuff that's cool out there. So I was like, I want some merch. I want something that people with spine injuries can wear, something that makes them feel some kind of way about their self. And so that was really my goal. It wasn't to do what I did. And then I started looking into it, and I was like, well, I'll just find like a Zazzle or something, make a design, print it, whatever.
A Zazzle.
And I was like, and my husband ordered something from some influencer, and he got it, and it fell apart in the wash like 2 days later. And I'm like, man, I don't want to do something that I can't put my hands on, that it's a representation of me and who I am, and I want it to be good. So I started designing like some logos. I worked with a local designer and came up with 4 core logos: the spine, brain, skull, and then my logo. And then I was like, I need to find somebody to put it on a shirt. And one of my greatest healthcare influencer friends, Nurse John, if you don't follow him, you guys, he's
hilarious.
He's a funny man, but he is like a true human being. He is so passionate and kind and so supportive. And so he and I had hung out one weekend, and he said, you don't need to let someone else do it for you. You need to do it yourself. And I was like, man, I don't know about that, blah, blah, blah. So long story short, he gave me the confidence to kind of go out there and talk to some people. So I put out some stuff on Instagram, had some people reach out to me. And anyway, I found this local boutique that does stuff, and we've partnered together to just basically do what I want. And we launched. It took 6 months to get to where we're at now, just to finally launching. And it's launched about a month ago, and it's just been fun. She actually just dropped off some new stuff at my doorstep just now, so I can look at it. But
that's awesome.
It's been fun, and I'm nervous about it, but it's something that if it flops, it flops. But I think just people in healthcare, we really like what we do, and to have something to express ourselves is just is kind of cool. So that's my goal.
Oh, absolutely. Yeah. And I mean, it's really, they are pretty. I am a shopaholic myself, and I really I noticed that it's I think your designs are cool, and I think you're right. I'm laughing. I literally just got a tattoo of a scalpel on my arm a week ago, and so I'm like, yeah, and I'm like, my husband, who's a pathologist, was like, why? And I was like, I just want it. I don't know. It's like I spent all day holding scalpels, and I just really want one.
Yeah,
And I
exactly.
know you recently got some big ink too, right?
Yes, yes. I have like I'm actually working on another piece now, but yeah, I didn't get my first. Is this your first tattoo?
It's my second.
Second. Okay, yeah. So it's gonna start, yeah, but I didn't get my first one until I was like probably 40, and I just couldn't. I don't know. I got this like it's a beautiful day to save lives because I just grew up loving Dr. McDreamy on Grey's Anatomy, and he's a neurosurgeon. And anyways, that was where I started. But yeah, I got this huge like spine piece on my side, and
The detail is pretty amazing.
yeah, I went to this guy in New York that does fine line, and anyway, he did a great job. So now I've got this. I'm working on this. Like I've got this neuron on the back, and it's gonna come around on my bicep, and like I'm gonna do some neurotransmitters on my bicep. I know this sounds really nerdy, but
No, I love it. See, I can appreciate this. I think our community can appreciate
hey,
this.
it makes me happy. So
Yeah.
anyway,
I mean, what we do is a very much a part of us, so why not literally make it a part of us?
exactly, exactly. I've got some stuff my kids have drawn on me too, and like this. I've like there are little hearts. Let's see if you can see it. That's when my
Oh
son
yeah,
taught her, and
yeah.
it says "love you more" right there because my son always says that to me.
Aw.
Every time I say I love you, he says "love you more." So I have that there. So every
Did
time I can just look at my arm and see it. Every time I scrub in, I see it. It just makes me feel happy.
And I think that that's like all the stuff you do, right? Like whether it's working on this new design or it makes you happy, and
Mm.
that's like our lives are short. You should
Right?
enjoy. You should enjoy a little
Be
bit.
happy. There are always going to be people out there that are going to judge what you do. It's just a part of humankind. Human nature is just to be judgmental. And once you put that aside and you just do what makes you happy, fuck the haters, man. I mean, just be happy, be yourself. Do what makes you want to get up in the morning and live your life.
Well, and I love too. Like I know that there's been a lot out recently, and I know you've yourself have talked about the toxicity of training, and I think that I don't think that that needs to be how it continues, right? Like you can be happy, you can have a family, you can be really good at your job and be at the top of your field, and not have to be miserable through your training and not have to suffer your whole career either. Like you can find a good place, but sometimes at this point, I feel like we have to help create it.
Yeah. Yeah. We grow up in this environment of residency training where we don't have control of us. I mean, we're literally at the beckoning call of our program and whatever. There's no choice in the matter, and we assume that's how our lives will be. But we're so far deep in it that we don't know any better, and there's really no escape. And I think that's why there's so much burnout in medicine and mental health issues and even suicide, because you feel like you're so invested in your field that maybe sometimes there's no way out. But I think folks like you, me, who kind of share our lives of what it's like after training, when you get through it, when you have independent practices and you can really do what you want and do the things in healthcare that you went into medicine to begin with. And that's kind of the light at the end of the tunnel to hopefully promote and propagate change even in training. It doesn't have to be like that, and I think it is changing. It's slow. I mean, we
It's
have
a hard system to change, but there's just directional movement. It's going somewhere, hopefully
yeah
in better places.
yeah it's going to be a slow, steady change, and definitely not perfect. But I do think that the more we uncover it, the more we talk about it, the more we point out things that need change, it's going to prompt change.
So I'd like to kind of end on where you think what's next for you. So you've done a lot of big things, but I have a feeling you're not a person that's like I've done enough. So what are you excited for in your future?
I don't know. I just lived that life one day at a time, man. I never would have thought 5 years ago that I would be on social media, and I certainly didn't think a year ago that I would be owning a company about freaking clothes and who knows. But I'm just enjoying what I'm going through now and where I'm at in my life now, and just trying to understand what keeps me going, and really trying to feed and foster my own self. That's really been the biggest growing point for me this year, is just knowing when I need to say no and putting up boundaries, and when I need to say yes and give myself opportunities. And I think it's, it's just a part of life, and where you end up, who knows?
Well, you are a very inspiring person, and I'm personally very excited to see what you do next, because I'm sure it will be something pretty awesome. She's like,
Well,
stop.
we'll see. TBD. Maybe someone else knows, but
And thank you so much for joining us. If somebody wanted to be able to find you and they're not already following you, what would be the best way for them to do that?
I mean, I'm a lady spine doc on pretty much any social media platform that exists, and yeah, I just thank you for having me on the show today, and thank you for everything you do for medicine and for your patients, and putting yourself out there, and for putting stuff together like this to share a little bit about what we do in medicine. So thank you.
Well, thank you so much. And, the future is full of bright, kick-ass women, and I'm very excited about that.
Oh,
So thank you all so much for listening to this episode of The Confidence Doc, and stay tuned for our next week's episode. Have a good night.
As we wrap up another episode of The Confidence Doc, I want to extend our heartfelt thank you for being a part of our community. If today's conversation resonated with you, remember that Dr. Rednam and her team are here to support you on your journey to self-confidence and beauty. Your story is unique, and it's our privilege to help you create the masterpiece that is your life. If you'd like to book a consultation with Dr. Rednam, you can visit her webpage at drrukminirednam.com. Fill out a contact form, and one of her coordinators will get with you accordingly.